The environmental services mission is to provide extraordinary care to patients.
We are not just another maid service. We are at the front line of infection control.
Infection control is just making sure that they're safe and in an infection-free zone.
We must take that job very seriously.
Because we understand that we're dealing with life and death situations here.
No one wants to get sick.
No job we do in our department is a small task.
Housekeeping is not necessarily a glamorous job.
We clean every accident that happened. I cleaned it.
A hospital can be a very intense place to work at. We deal with real people with real conditions.
We are here to add not only a clean environment, but also to provide support to those patients.
There was a patient room that I was cleaning, and she had requested that her room was cleaned again. So I went back in and I re-cleaned it again, and I started talking with the woman, and it turns out she was just really lonely and she just wanted someone to come and spend a little bit of time with her. I was able to stay and talk with her and make sure that she felt that she received the care she needed.
I love my job. I love to help people.
Our job as a housekeeper is as important as one of the nurses, one of the doctors.
An ideal candidate for me was someone who can be flexible and dependable.
Who is outgoing and very personable, but also someone who's willing to work hard and who isn't afraid to get in there and clean up.
I don't think people necessarily take into consideration is that we are heavily regulated. We have a lot of rules.
So our role as a management is to educate our employees, to let them know this is a career.
Ultimately, I think what helps motivate people is when they recognize the difference that they can have in a patient's life. That provides a huge level of job satisfaction.
I know I'm making a difference.